more manually adjustment focused office, which means that we use our hands, and people associate that with the popping noise, the cracking noise as they label it. Like you said, it's more than just, a release of noise, right? We do use x-rays, which I think is super valuable. A lot of offices, I shouldn't say a lot, but I've been in offices, worked in offices that didn't. It's just a valuable tool, like you said, to see underneath the skin. So the adjustments that we primarily give are somewhat driven off of x-rays. And a lot of our focus, again, is to correct structure, alignment, and function, right? So that the body overall functions better. So for us, we find that we do best and we get best results when it comes through a manual adjustments with our hands versus, say, an instrument. But there's so many different types of adjusting modalities and tools nowadays that I'm not knocking at any one of them. We just tend to kind of focus more through hands-on delivering adjustments.
Yeah, and piggybacking off that too is manual adjusting is not the only way to adjust.
No.
Right?
No.
So if somebody comes in and they're 90 years old and they have, osteoporosis,
right,
and we take an x-ray and they have degeneration, we're not going to set up a manual adjustment on that person.
Yeah.
And the same thing with a baby. Sometimes we get questions like, oh, you guys manually adjust, like, do you adjust a baby like that? And that question's funny, but I get it, because that's one thing that they don't know. They don't know. Yeah. And so with babies, it's tonal. Right. So it's pressure. Yeah. And it's being more specific in where we guide that pressure based off of the history, or what the parents are seeing with that kid, or what they want to see improve.
Yeah, and with that, our office, I know we can't really see it from this view, but it's slightly open base, so patients can sometimes look in and see us adjusting, and sometimes they walk in with questions like, "Whoa, are you going to do that to me, or is that what it's going to look like?" And a lot of times, the nervousness is kind of settled when they see us adjust, because it doesn't look like they think it looks when they're on the table getting it done to them. Especially with the neck. I know it's a big one for a lot of people. But like you said, we can even tone down or even adjust the way that we manually adjust based on the patient's, either comfortability or whether we feel tension in their body, so they're just not going to be willing to accept that adjustment. So yeah, at least in this office, I think we do a pretty good job of adapting to the patient as far as what we feel is best for them, but also meeting them halfway with where they're comfortable at.